So, hello, beautiful people. I'm going to talk about why your vaginal infections keep coming back, why you keep getting vaginal infection 2 or 3 or 4 times in a year. So, what are the things that make this infection to keep coming back even after you think you must have treated it? The first one in the list is you may not have treated it well. You may have used a wrong kind of treatment, or that the treatment did not go well initially. So most women are fond of abusing antibiotics, like say they are having that itching. The first thing you see is they will go to a chemist shop, they will just walk into any drug shop like here in Nigeria to obtain antibiotics. You may end up getting a wrong antibiotics, and when you get a wrong antibiotics, it will kill both the good and the bad bacteria in your vagina, giving room for the candida to multiply more than it. So instead of it healing, you see yourself, it will be multiplying. The symptoms will continue to multiply. Then the second one is undiagnosed treatment, that is going for treatment without diagnosis. If you listen to me always, I talk about going to hospital. There are a lot of things that hospital saves you time. The first one is even before you start any treatment, you'll be sent for what we call high vaginal swab, MCS, that is for sensitivity, culture and sensitivity test. It is with this culture and sensitivity test that they can be able to identify the real antibiotics, that is the best antibiotics or the best antifungal cream that will work for your own. Now, that is the first thing you're supposed to do, but some women don't do that. So when you go for a treatment without first of all knowing the organism that is causing the particular organism responsible for that your korokoro or itching, then you go for wrong medication. That means even after taking that medication, that thing will also come back. Now, some of you will now say, nurse, but is a doctor that prescribed it? Yes, doctor can prescribe for you. After the prescription and you take your medication, say for 7 days, after the 7 days you are still having the symptoms, what you're supposed to do is to come back to the hospital. Don't go and buy another one. No, when you come back again, you'll be sent for another swab. You go for another vaginal swabbing. They will now check. You notice that some say a Escherichia coli, like a candida that is there. You see that the number, if it was +3 before, it may now be +1. So the doctor will now try to change either the antibiotics or to reduce the quantity that he gave you. Then when you now take it alongside with other antifungal cream, you see that you are going to get yourself. Then the second thing also that causes this is when you have a resistant yeast. Say the yeast is not responding to the treatment, or that the yeast have already developed resistance in your body as a result of abuse of antibiotics. Then the third one is that you may be pregnant. Yes, women that are pregnant tend to have this yeast infection. Like you cannot, as you are treating it, it will keep on coming back because of the high level of estrogen and progesterone in the body, and this has a way of altering the bacteria, the normal flora of the vagina, hence exposing this woman to overgrowth of candida in the body, that is in the vagina area. So some women who are pregnant do have this. Then if you are pregnant, you will not know the reason why this is coming. Then the fourth one is that this thing you say that it is yeast infection, that is vaginal infection. It may actually not be vaginal infection. Yes, there are so many medical conditions that mimic each other by their signs and their symptoms. So there are other conditions that can make you to have itching, soreness of the vulva, vaginal discharges, foul smell from your vulva, and yet they are not yet yeast infection. Something like vaginal trichomoniasis or genosis, or those that have sexually transmitted infections, or those that have reduced immune system. So your body may be showing signs of vaginal infection, but what you may have is not vaginal infection. So you may be treating a different condition altogether. So if you must have gone back to the hospital and the doctor check you and recheck you again, and it's coming back please, you need to go for another re-evaluation, even if it means changing from that gynecologist to see another gynecologist, to make sure that you get a good diagnosis. Then the final one is in cases of immune disorders, when the immune system of a woman is down, like people that have HIV and AIDS and other viral infections, it tends to make their immune system to be down. And when their immune system is down, it affects different areas of their body. Another chief thing, I forgot to say this earlier, another chief thing that causes this yeast infection, this vaginal infection, to keep coming back is the presence of diabetes. There are some women that may not know that they are diabetic, and they are having reoccurrence of this because of the high blood sugar in their blood have increased. It gives room to this candida bacteria to keep on increasing. So if after all treatment and your doctor forgot to send you for blood test, for blood sugar test, what we call fasting blood sugar or random blood sugar, that is the way they do it in the lab, then you can request for that. Sometimes you find out that the blood sugar of these women is high. I believe that with these few points that you've understood why your yeast infection keeps coming back. So my name is Amara Uzodigwe. We are stopping here today. My name is Amara Uzodigwe, registered nurse midwife practicing in Nigeria. If today is the first time you are stopping to my channel, you're highly welcome. Yeah, so you're highly welcome. Don't forget to click the notification bell and the subscribe button by the side so that you'll be easily notified each time I upload a new video. See you next time. Bye.